Like I said, I'm Katy Harlan, also with MODOT, their Central Office Highway Safety and Traffic Division. So I'm going to talk about vulnerable road user safety assessment that Joe kind of alluded to there at the end. Go to the next slide. So I'm going to talk a little bit about the VRU safety performance that we saw, some of the engagement that we did across the state, and then some of those strategies, projects, recommendation type things that we have as part of this assessment. Next slide. So I would start off with what is a vulnerable road user. So that's kind of just a blanket term, but it's really any pedestrian, bicyclist, or person traveling by personal conveyance. That's typically always where the question comes up, what's a personal conveyance? So those are really anything like scooters, wheelchairs, anything like that. The big thing that this does not include are motorcyclists. That's typically a big question that I get, and that's because of the official federal highway definition that we had to follow, and so those are not included in this, just as we go through this. All right, so next slide. So start off talking about the VRU safety performance. So one of the big comments that we always get when it comes to anything with VRU is that, people don't walk, they don't bike. That's very much not true. And so looking at just 2024 alone in the state of Missouri, we had over 760 million miles walked. And we also looked at biking. If you go to the next slide. Yeah. And we had over 110 million miles biked. And so we can show that definitively with some numbers for our state specifically. And unfortunately, with those trips and things, we do get fatalities, serious injuries. And then from 2015 to 2023, we had over 1,100 fatal VRU crashes. And that does have a cost societally. And so total, this includes more than just the fatal, but we have seen in that same time frame over $17 billion of societal crash costs associated with that. So it's also important to note that over that same time period, crashes in general have gone up statewide. But they've gone up at a much lower rate than VRU specific crashes. And you can kind of see that in that chart there, that they've increased over 50% in those 10 years, whereas our total crashes have gone up by only 14%. So knowing all this information, we analyzed the system statewide and came up with a higher injury network, and we also have a higher crash potential network, and I'll talk a little bit more about that in a second. But the higher injury network really looks at where those crashes have occurred and trying to pinpoint where specifically in the state that we're seeing these types of crashes most. And when you start to look at it, it's really a very small portion of the total miles in our total roadway network. So it's 788 miles of our total networks, and over half of the VRU fatal and serious injury crashes that we see occur on that higher injury network, which is less than 1% of our total network. And so those are kind of the numbers. And so if you go to the next slide, there's maps that go along with that, and there's PDF versions of these in the assessments. There's also a web version, which is on Save Mo Lives now. So you can kind of zoom in and be able to look at this a little bit more in depth. But it does show the system and where across the states that we have identified this higher injury network, and it's broken down by city streets, which is just local streets, and then MoDOT, like state-owned roads. And similarly, there's also a higher crash potential network. And so this network is a little bit different. So it still looked at where we saw those crashes, the VRU crashes occur, but it also looked at the roadway itself. And so what are the common things that we see that we're seeing these fatal and serious injury crashes? And are there other roads that maybe haven't had a VRU crash on them yet, but has that potential to? And so it looked at a bunch of different factors, including number of lanes, if the route was served by transit, if it was near a park, if it was near a school, and several other things. So there's a lot of things that go into that. And it's broken down into a higher crash potential and like a moderate crash potential within that. So that is some of the data and things that we did initially, and we kind of got those together. And then once we did that, we started engaging across the state. That's actually one of the requirements of the assessment is we do consultation, and we wanted to focus on that and bring a little bit more emphasis to it this time around when we did this. And so we did a couple of different things. So the first thing we did was the two statewide agency consultations. They were virtual meetings that we did. And so we got people from all over the state and had a conversation about the data that we were seeing, what were their concerns, and just different things that we could work on as part of this plan, maybe include. And then we looked at the local communities where we saw a higher crash potential cities. And so this looked at a bunch of different factors to come up with these cities. And we looked just at cities. They were actually all in our St. Louis district. And so to try and spread it across the state a little bit more to have more in-depth conversation more widely. We ended up doing these more in-depth workshops with St. Louis City, St. Louis County, Kansas City, Springfield, and then Sedalia. And within those, we kind of did a VRU focus. Initially, what is the current state? We did a presentation on what was the data that we had seen so far. We asked the locals to give a presentation on what they were doing. And then we talked about different strategies to help improve VRU safety, some barriers to implementing those strategies, and then we tried to brainstorm some solutions with them. So out of all of that, we did get a lot of good lists with each of those different categories. If you go to the next slide. So there were a lot of overarching things that we saw: infrastructure improvements, planning coordination, enforcement, education were a lot of the strategies. Funding came up a lot in terms of barriers, policies, and then solutions for that, more in education, engagement, policy, updates that we can make, and various things like that. And so we got a lot of good lists and good ideas of how we could move forward. So we use all this to come up with some outcomes. And so, like Joe mentioned, if you go to the next slide, um, this is part of our strategic highway safety plan. And so there's some elements within the VRU assessment that do mirror some of the things that were done in the SHSP to kind of have some continuity as well. But one of the other big things in the outcomes is that we also did a program of projects. And I will specify that these are not specific projects. You don't have to do the limits of what's identified here, but these are looking at that higher injury and higher crash potential networks, and pulled out the top 100 miles of MoDOT roads and top 40 miles of local roads, where there's a 200 times higher than the state average VRU crash rate. And so it's really trying to narrow down even from that. The higher injury network obviously is a very small part of our total state network, but this is a little bit more focused as well. And there's some of these that we know that we already have planned projects, they just haven't occurred yet, or there's reviews already being done. And so that doesn't necessarily mean that we're not addressing these already, but we're just trying to bring a little bit more emphasis and trying to help direct people a little bit more of maybe where a good place to start would be. Additionally, within the outcomes part of that, we do have the safe system elements and some recommendations within each of those as well, of just various things we can do. And it's not necessarily things that, just the public has to do or whatever. It's like a shared responsibility part of that, of where it's MoDOT and partners and the public and everything as well within that. And one of the pieces, if you go to the next slide, that we did that mirrored the SHSP that Joe kind of touched on was those different categories or different groups of people. So like the cities and counties, law enforcement. We also have a individuals and families section within that. And so it gives recommendations if you're part of those specific groups, to be able to give you some direction of things you can specifically do as well. So I know it was a very quick, high-level overview. I think that's the last thing that I had. I could talk about so many other things along with this as well. And so that was just my high-level overview of everything.